LA County is one of the hardest hit counties in the state right now. And while we don't know exactly how long these stay-at-home orders will last, Governor Newsom did give a bit of good news. He revealed most of the state is starting to see a plateauing of new hospital admissions, but that's not the case here. Today, Governor Gavin Newsom highlighted the crisis unfolding in LA County, which has had an average of 12,000 to 15,000 new cases a day, putting a huge burden on the hospital system. Governor Newsom says he has sent teams to LA to help coordinate the hospital response and is sending federal resources from the Department of Defense to the regions where the number of cases and hospitalizations are out of control. He gave a few examples of how bad that burden has become.
96% of LA County hospitals were on diversion at some point over this weekend on Saturday. On average, LA County hospitals spent 2/3 of their day, or 16 hours, on diversion, just 8 hours when they weren't on diversion.
To help LA County deal with this surge, the state's health teams will help coordinate what's being called hospital load leveling. That's the process of easing one hospital's load by moving patients to a hospital where the load isn't as bad. Following the governor's address, LA County Health Director Dr. Barbara Ferrer continued with the grim numbers for LA County. She mentioned daily hospitalizations are now at record highs, over 6,900 COVID patients, and that usually results in an increase in COVID-related deaths. She listed how many people are getting infected per minute and per hour.
On average, 9 to 10 people in LA County test positive for COVID-19 every minute, or 540 to 600 people test positive every hour. This translates to tremendous capacity for spread across every sector and every community in our county.
Both Dr. Ferrer and Health Services Director Dr. Christina Galley warned the worst is yet to come due to the incredibly high number of travelers, Christmas shoppers, and others who are not adhering to the stay-at-home orders. Also, to add to the challenges, there's a shortage of oxygen canister supplies for COVID patients to take home. And at some older hospitals, the aging pipes are struggling to handle the demand of oxygen flow. Again, Dr. Ferrer went further than the governor did today, announcing that the safer-at-home orders will be extended and remain in effect as long as the ICU capacity remains below 15%, the threshold set by the state. I'm Jasmine Veal, CBS 2 News.